Hello everyone, I'm Nur Airin binti Samsudin from University Malaysia Terengganu, and in this video presentation I will talk about history of chemotherapy, which is antibiotics and vaccination that used in fisheries microbiology. According to American Cancer Society, chemotherapy means the use of medicines or drugs to treat cancer, and chemotherapy is defined as treatment of disease by means of chemicals that have a specific toxic effect upon the disease-producing microorganism or that selectively destroy cancerous tissue. Antibiotics are powerful medicine that fight certain infections and can save life when used properly. They either stop bacteria from reproducing or destroy them. The first antibiotic was penicillin. An antibiosis between microbes was described well before the discovery of the penicillin, including by Louis Pasteur, who proposed that microbes could secrete material to kill other bacteria. Antibiotics are designed to inhibit the growth and to kill pathogenic bacteria. But the common practice that occur in the fish industry, particularly in developing countries where large amounts of antibiotics are used to avoid infection, according to Cabello 2006. The continuous and heavy use of presence of antimicrobial drug residue in the edible tissue can cause allergies, toxic effect, changes in the intestinal microbial fauna, and acquisition of drug resistance. Antibiotic can even be considered as a major factor that is responsible for affecting the microbial community in the environment. Antibiotics act as an ecological barrier in the environment that could potentially affect microbial communities. The effects include structure alteration, resistant expansion, and ecological function disturbance in the microecosystem. Besides it absorbing particulate matter, especially in the marine environment, the usage of antibiotics in the fish and shrimp aquaculture has become a major problem, with seepage through pond bottom and discharge as waste and effluent mixings into the runoff water and covering coastal mangrove, destroying important natural habitat for shrimp and fish. Then the accumulation of this antibiotic in sediment will definitely alter the natural function that might take place in the environment. This is the reason that the most of the importing countries have completely banned the use of certain antibiotics. Okay, so the first vaccine was developed in 17 and 1906 by Edward Jenner, with the principle that behind of this vaccination, disease can be protected if you are subject to a milder form of the virus, which means the disease that causing an agent. The term of vaccine is come from smallpox of the cow, whereas the Edward Jenner found that the milkmaid who had previously been infected with very similar disease, a less severe disease called cowpox, that we are actually showing protection from getting smallpox. And he believed that the disease was caused by of the bad air known as miasma. Miasma is a foul-smelling rotting particle in air that could cause the disease. And here is some of the article or journal that I use to finishing my video presentation about antibiotic and vaccination used in microbiology. The first vaccine for aquaculture is a vaccine for prevention of yersiniosis in salmonid fish, which was licensed in USA in 1976. So when the disease appear, we use antibiotic or chemotherapeutic for the disease treatment and even for the disease prevention. A study by Friedel concluded that chemotherapy with sulfamerazine was superior to oral administration of a vaccine for the control of Furunculosis. Furunculosis is a deep infection of the hair follicle leading to abscess formation with accumulation of pus and necrotic tissue. And it appears as a red swollen and tender nodules on hair-bearing parts of the body, and most common infection agent is Staphylococcus aureus. In salmonid, the great challenge in disease prevention was furunculosis caused by Aeromonas salmonicida. Based on the positive experience with prevention of vibro infection using immersion vaccine, there were great expectations for similar effect with a furunculosis vaccine. However, immersion of furunculosis bacterium was found to give insufficient protection. Injection of simple whole cell culture bacterium stimulate a protective immunity, but the magnitude and duration were less than desired. The word vaccination originates from the work of Jenner, who inoculate a boy with infectious material from cowpox in order to induce immunity to smallpox. He called the process vaccine inoculation, and the word vaccinology is of more recent vintage. According to Salk 19 and 97, he introduced vaccinology to describe the interdisciplinary dimension of disease prevention based on microorganisms stimulating the immune system to prevent infectious disease in individual and population. Vaccinology includes different disciplines, which is immunology, adjuvants, and administration. 150 years, there have been several studies about fish immunology and biology, which is relevant to vaccine. Different fish species were included in the immunological study, and factors of importance in vaccinology like temperature and other environment factors were also studied. And the role of adjuvant in fish is important both for the progress in immunology and vaccinology. As an example, trout was found to produce a good immune response when injected with antigen from Aeromonas salmonicida. However, parenteral introduction of antigen seemed to be economically prohibitive and might even be harmful to the fish. So that is why the oral immunization was therefore considered to be the only way for practical disease. Successful vaccination could also be performed by dipping the fish for a short period in a dilute vaccine solution. And buff vaccination was another type of immersion vaccination based on uptake of antigen through gills, skin, and the lateral line of fish. But today, the majority of the fish vaccine are delivered by injection, which is by far the most effective method compared to the oral and immersion route. The injection method is, however, labor intensive and not feasible for small or young fish. In a population of wild fish, disease have been considered as a part of a normal biological process. In culture of fish, the situation gradually changed and the number of fish and the density has increased. And the disease which were considered to be a phenomenon in the wild fish population sometimes became a problem in a fish farm. Disease prevention should be based on measures including the factor of the agent, the host, and the environment. However, aquaculture has some disadvantage compared to bioproduction of terrestrial animal, and pathogenic microorganism may be transmitted through water. Furthermore, the disinfection is difficult as in the marine environment, even it is impossible. But then, the side effect and risk associated with chemotherapy reduce the use of antibiotic to therapeutic use, and even that should be limited because some environmental factor might be controlled but others like water temperature could not be influenced. The resistance of the fish based on natural or acquired immunity was therefore a crucial factor for the health of farm fish. Okay, for the next topic is herbal therapy in fisheries microbiology with the help of the journal with the title Phytotherapy as an alternative for treating fish disease. The main criticism surrounding the use of this drug is the presence of residue in water, sediment, and fish. which is lead to toxicity in non-target organisms such as plants, crustaceans, and even wild fish. Nonetheless, producers have made use of highly toxic substances, including molecules that have not been registered for treating fish disease, which is worrying. Then are used to reduce the load of pathogenic microorganisms on the biological surface of aquatic organisms, and their use on fish is associated with broad spectrum, fast acting, and low cost characteristics. The best known substances are hydrogen peroxide and formalin. Although disinfectants have low potential for bioaccumulation in the environment and in aquatic organisms, their deleterious effect on fish and on workers through direct contact with this product present risk, thus making it uncertain whether there is a future for their use in aquaculture. While malachegrin is widely used for controlling various fish parasites, and it has been shown to be effective against this important pathogen of fish. However, this product has been banned in several countries because of its mutagenic and carcinogenic effect, and it hides persistent in the environment, give the bioaccumulate in the ecosystem and in fish tissue. Of antibiotic and veterinary drugs in aquaculture can pose risk to food safety and consumer, as well as causing toxic injuries to fish and deleterious effect on the aquatic ecosystem. Antibiotics are another class of product widely used in combating important fish disease. However, several other antimicrobials have been used in aquaculture even without registration and approval. Inappropriate use of antibiotic in treatment and prophylaxis for bacterial fish disease is associated with increasing of problem related to selection of resistant bacteria. Phytotherapy is a treatment using product obtained from medicinal plants to replace drug. Medicinal plants have broad antiparasitic, antibacterial, and antifungal activity. Antimicrobial is a properties of substance derived from plants. Studies on controlling parasitic infection in human and animals, including fish. Their use in fish farming can contribute toward reducing the use of chemotherapeutic parasiticide, thereby providing greater sustainability for fish production with reduced environment risk while having the capacity to treat fish disease and consequently avoid mortality and therefore economic loss. Here is the table of phytotherapy with greatest potential for use in aquaculture to treat the parasitic disease. A wide range of phytotherapeutic is also known to have antibacterial activity against human and animal pathogen. Replacement of the current antimicrobial used in aquaculture with herbal product is not a utopian concept given that several medicinal plants have shown activity against important pathogenic bacteria of the fish. On the other hand, phytotherapies are less prone to development of bacterial resistance because of their mode of action affecting several targets at the same time. And the most common administration routes for herbal medicine used in treating bacterial disease are by immersion or orally. Because of the large number of studies, many types of phytotherapeutic and different forms of treatment, comparison between the data in the literature is difficult. Oral treatment has been showing excellent survival results in fish with bacterial disease, and batch of sick fish need to be treated even if some of them are not eating, because within the same fish cage or pond there are many subclinically infected fish and newly infected fish which have a high chance of cure. Therefore, use of herbal medicine in the diet is promising for treating large batch of fish that are suffering from bacterial disease so as to be able to avoid the loss of loss.